Hello, I'm Dr. Anindya Mukherjee. I'm a cardiologist from Kolkata. So today we are discussing about understanding heart attack. So in today's session, we will discuss about heart attack, its causes, and the preventive measures needed to avoid it. Nowadays, we often come to know that the person died due to heart attack even at the age of maybe 30s or 40s. So the incidences of heart attack and the number of deaths due to it are consistently increasing in India and worldwide, and also in our own state or city. So let's understand what is heart attack and what can be the reason behind it. Heart is the most essential organ, and its non-stop functioning is crucial for our survival. It functions like a pump and allows the circulation of blood throughout the body. The blood circulated through the extensive network of various types of small and large vessels. Blood ultimately provides all the nutrition and oxygen supply to the various organs which are necessary for the normal functioning of that particular organ. So the muscles of the heart are continuously contracting and relaxing to pump the blood into the blood vessels. This pumping of the heart leads to what we can hear as the heartbeat. On an average, in the healthy normal person, the heart beats for around, which is 60 to 100 per minute is normal. Around 70 or 72 is a normal heartbeat. So this means the heart muscles contracts and relaxes around 60 to 100 times per minute, or more or less around 70 or something like that per minute. So to do such an extensive work non-stop without any interruption, it requires continuous supply of oxygen. For this, the heart has its own network of blood vessels around it, which continuously supplies oxygen to the various heart muscles. Any interruption of the blood or oxygen supply to the heart for even a few seconds can impair its function and leading to heart failure or heart attack. Heart attack per se. Basically, a heart attack occurs when the blood vessels supplying blood to the heart are blocked. What do we mean by a significant blockage? For us, more than 50% is a significant blockage. If it's more than 70%, we go for intervention, that is, to revert the blood flow, we need some procedure like angioplasty. Now let's understand why there will be blockage of blood vessels. Main reason behind such incidences is increased blood pressure and excess of cholesterol and fat deposition in the blood vessels. Persistent high blood pressure damages the blood vessels by making them more rigid and by damaging their inner walls. This increases the risk of cholesterol or fat deposition in blood vessels. When there are excessive fats, it gets deposited in the inner walls of the blood vessels. It blocks the blood flow, and slowly the thickness increases and reducing the lumen of the blood vessel. Due to these blockages, the heart of the person with high blood pressure has to work harder to pump the blood throughout the body. This increases the workload and oxygen demand of the heart. The increased demand and lower supply of oxygen due to the blockages ultimately leads to failure of the heart to function properly, which either presents as an acute heart attack or may present as slowly progressing failure of the heart, which is known as heart failure. A heart attack may cause multiple symptoms. Chest pain is the most common symptom of a heart attack. They can feel like uncomfortable pressure, aching, numbness, squeezing, fullness, or pain in your chest. This discomfort can spread to your arms, neck, jaw, or back. It can last for several minutes or come and go. However, it's not the only symptom. The possible symptoms of a heart attack are dizziness or fainting, lightheadedness, nausea, indigestion, vomiting, or even shortness of breath. So if a patient whom we think that heart attack can be an option and he has just a symptom of pain abdomen, or maybe dizziness or just some nausea, we should not neglect that. These heart attack symptoms can be different for each person. No two heart attacks are the same, even for the same person. The person may have just one or a combination of symptoms. Sometimes the symptoms of heart attack are not classic crushing chest pain that one thinks of. One may feel less obvious symptoms such as burning feeling in the chest and shortness of breath. Sometimes one may have no warning symptoms at all, most commonly in diabetic patients. A heart attack is a medical emergency. A heart attack can only be diagnosed clinically and then by some medical tests. The only way to know what you are experiencing is to seek urgent help. Medical test includes a ECG. This can help and provide information regarding the extent and the location of the heart blockage and the muscle damage. It also detects the heart rate and rhythm, whether or not one is having a heart attack. Echocardiography, it is an ultrasonography test that can be used to learn how the heart is pumping overall and what areas might not be pumping normally. Then comes coronary angiogram. It is an invasive test to directly visualize the arteries and see how much blockage is there. It is frequently recommended in the first hours of heart attack if medications are not relieving the symptoms. In fact, if the person is having a heart attack, the recommendation is to do an angioplasty within 90 minutes. The blood test overall, the test will also measure the amount of damage. So there are some blood tests called troponin I or troponin T, which also gives us a hint that there has been a heart attack. A heart attack mostly requires emergency treatment to restore the blood flow to the heart. The faster this happens, the less the heart muscle is damaged. Heart attack treatments may involve medications or surgery or maybe minimally invasive procedures like angioplasty. Medications are antiplatelet medications, beta blockers and statins, blood pressure medications, some medicines to reduce the chest pain, some thrombolytics. Heart attack can be prevented. Knowing your risk of coronary heart disease is the first step to reduce having a heart attack. Yet many people don't know that they are at risk. The best way to find out that you are having a risk of heart attack is to regularly undergo health checkups if you are above a certain age, maybe 40 or 45. One can reduce the risk by making their positive changes to lifestyles, such as reducing high fat intake, that is, foods higher in saturated fat can contribute to high cholesterol and reduces the blood flow and increases the risk of heart attack. Hence, it is also important to start a healthy diet to reduce the risk. Limit foods high in saturated fat, like processed food. Choose unsaturated fats which don't raise the cholesterol much. One can find unsaturated fats in foods like nuts, fish, vegetable oil, olive oil, and sunflower oils. A diet high in fiber can help lower cholesterol levels by as much as 10%. This diet emphasizes the increased intake of fruits, vegetables, whole grains, poultry, fish, nuts, while curbing sugary foods and beverages. Eating and drinking too much sugar raises the triglyceride levels. A heart-healthy eating plan can help manage the blood cholesterol level. One must control the high blood pressure, so one must avoid drinking much alcohol, taking extra calories, cigarette smoking, and of course extra salt intake. Following an exercise plan and maintaining an ideal body weight is also important. So regular physical activity makes the heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort, reducing the risk of hypertension and heart failure. Exercise cuts bad cholesterol levels and raises the good cholesterol level, that is the HDL. One can aim to get 2 hours and 30 minutes of moderate aerobic activity per week, like brisk walking, or 1 hour and 15 minutes of high intensity exercise such as jogging per week. What we normally prescribe is 30 minutes per day for 6 days a week. Maybe Sunday you can take as a holiday. Monitoring the stress levels and getting adequate sleep are also possibly the best ways to prevent heart problems. It is important to remember that we can afford everything, but nothing is as precious as the health. It is possible to make heart healthy and prevent heart failure or heart attack through lifestyle interventions like dietary modifications and exercises. By taking action to lower blood pressure, one can help protect themselves against heart attack. So, to summarize, what we must say is that a person should be careful about his heart health regularly, doing regular exercises, reducing saturated fat intake, fast foods intake, and processed food intake, cheese intakes, this should be reduced. And one should be very careful regarding visiting the health practitioner or doing certain tests regularly, maybe in a 6-month interval after a certain age. Even in young patients who have high risk factors like smokers or having diabetes or maybe obesity or a deranged lipid profile, they maybe need to undergo the test earlier than the prescribed age of 40 to 45 years. What we need to do is go to a general physician or a heart specialist, get some routine blood tests done, get a ECG done, maybe a echo if required, and then we know what the heart status is. And if we are having a sudden chest pain or any awkward symptom in our heart, we must consult the doctor, get a ECG done, a blood test like TROP-T or TROP-I, as I said, and we should be very sure that we are not suffering from heart attack, even if it's a simple pain in the abdomen or a simple uneasiness or fatigue or a dizziness. In this way, we can know that whether we are suffering from a heart attack and can treat it in the right time when required. So this is very important, and as I told, it's the first 90 minutes that matters. So you should be very careful regarding your heart, and you should regularly go to a medical practitioner and keep in mind the alarming signs or the danger signs and take care of them. Thank you so much.